Hello, my name is James Lucesi, and welcome to the latest event in our Compass Health Activation webinar series. Today's webinar is entitled, Employee Health Activation Improves Health and Lowers Costs. Today's webinar is presented by Compass co-founder and Chief Medical Officer, Dr. Eric Bricker. And with that, I will now turn the floor over to Dr. Bricker.
Well, thank you so much, James, and thank you to all of you for joining our webinar today, Employee Activation Improves Health and Lowers Costs. And just for all of you that are joining, just real quick in terms of my background, many of you know me. We have existing clients. We have prospective clients on the line, many broker and benefit consultants that we work with. So I know that many of you know me, but for those of you that don't, there's a picture of yours truly. I'm a general internist, did my residency training at Johns Hopkins in Baltimore, and actually did research on healthcare quality, specifically around diabetes care and hospital-acquired infections. Also, believe it or not, in my previous life before being a physician, used to be a hospital finance consultant. Used to be back in the billing and business office of major medical centers dealing with all the claims issues that insurance carriers and employers and individuals deal with. But I was on the flip opposite side. I was on the doctor and the hospital side of the claim. So just wonderful experience, but wanted to be more clinically oriented, so went on to medical school and residency, and just really saw the confusion and frustration that that my patients were having when I would see them at the bedside, and then kind of wanted to use my prior finance background along with my other co-founders at Compass to really bring that type of health activation, healthcare consumer tool navigation support that really, as a physician, I just couldn't provide for my patients while I was assisting them clinically, and that need really expanded greatly with the growth of high deductible health plans and consumer-directed health plans, where employees were actually having to be healthcare consumers or stewards, oftentimes for the first times in their lives, and employers realized that they needed to give their employees tools and support in order to become the good healthcare consumers that they all needed them to be. And so that was really sort of the nexus or the genesis for Compass. Also read a blog that's widely read, and we have a LinkedIn Healthcare Price Transparency group that if you sign up for, you'll actually get the blog emailed to you on a daily basis if that's something that's of interest to you. And so, very high level, Compass has a health activation platform that involves in-network pricing quality, transparency. We do health system navigation or advocacy. We assist people in terms of closing gaps in care for preventive care for things such as mammograms or colonoscopies, or people getting their annual physical, screening for high blood pressure, diabetes, things of that sort. And then we steer people to the highest quality, cost-effective physicians in a Pathways of Care program as well. So really, that whole idea is for people to be more activated or active in their healthcare and in their health management. And in today's modern healthcare world, it's just almost impossible to do that alone. And that's why we offer people that Health Pro Concierge to support them side by side. These are some of the employer clients that we have. T-Mobile there in the upper left, in technology, obviously cellular, education such as Southern Methodist University, utilities such as Energy Future Holdings, which is TXU, and Encore and Luminant, and then Atmos Energy is another utility as well. Their natural gas utility, retail, Michaels and Dillard's, another technology, Tyler Technologies and Sabre, they both do software, obviously Southwest Airlines in the airline industry, and then in manufacturing, Overhead Door and Barry Way Miller are two fantastic manufacturing clients that we have, in transportation with Melton Truck Lines out of Tulsa. So those are just some of the 2,000 plus employer clients that we have, and we're just so fortunate to be able to work with them. And today we're going to talk about employee activation. Again, we did a previous webinar about activation, but I just kind of want to rehash the definition of health activation. This actually comes from Health Affairs, is the big sort of health policy journal. It's wonderful. It comes out on a monthly basis. There's an article from February 2013 that that actually did some research into patient activation, and it defines activation. You can see there the second bullet point as it emphasizes a patient's willingness and ability to take independent actions to manage their health and care. So by activation, we need action. So it's essentially behavior modification, or a different type of behavior when it comes to using healthcare services. That's as opposed to engagement. So if you look at essentially the Venn diagrams over here, activation or action is a subset of engagement. Engagement is a broader concept. Again, this is from that Health Affairs article that includes activation, but it also includes things such as attending a health fair, just awareness, clicks on a website, forms filled out, registrations on a website. So it is maybe the precursor to action. It's maybe the precursor to a change in behavior, but it's not the actual behavior change itself. So that's why at Compass we focus on activation, because we really need to have people act differently when it comes to their health and their health care. So what we're going to do today is to go through some specific real member examples at Compass that have shown different types of healthcare activation. Okay, so this first one is an actual email from a Compass member to their HR department about their Compass experience. So Anna here, that name has been changed, from our HR department asked if I would be willing to share my story on being diagnosed with thyroid cancer. Please see below. I went in for an annual physical as a requirement of the Healthy You incentive. I am not proactive about getting in for a physical every year, but because it was one of the steps to qualify for the incentive, I made an appointment to see my family doctor. During my office visit, my doctor noticed that my thyroid was very enlarged. I had a history of having a large thyroid with no side effects, so wasn't concerned. My response to the doctor was, "You say that every time I come in for a checkup." My doctor suggested I get an ultrasound on my thyroid just to make sure everything was okay. I had an ultrasound completed and the results came back with a growth nodule that looked suspicious and was advised that a biopsy was needed to rule out cancer. The biopsy was completed and the test results came back with the nodule having cancerous cells. I had surgery to remove half of my thyroid 2 weeks ago. A pathology report came back as cancer, specifically papillary carcinoma. The cancer was contained to the right lobe of my thyroid and the surgeon is very confident that they removed all the cancer during surgery. I communicated to Michelle that if it wasn't for the requirements of the Healthy You incentive that to have an annual physical, the cancer would have been caught in its early stage. I most likely would have put off for a couple more years going to the doctor to have a physical. Who knows how big or where the cancer could have spread to. I truly believe participating in the Healthy You incentive may have saved my life. For all the people that are hesitant to participate in the Healthy You incentive, I urge them to reconsider. It just may save their life. So just a miraculous story. I mean, just unbelievable. What are the take-home lessons of that example of that Compass member? One is just the value of a primary care visit. Okay, so that Healthy You program that employer had actually had a financial incentive in terms of a premium differential where if the employees went to get their annual physical, they would get less off of their biweekly paycheck contribution to their annual premiums. And obviously, going to a primary care visit is great to have what we oftentimes talk about here on these calls, the U.S. Preventive Services Task Force screening, such as blood pressure, glucose for diabetes, age-appropriate screening for cancer, such as mammograms and colonoscopies, things of that sort. But at the end of the day, just seeing the doctor and having them perform a physical exam is super important. That's where the actual, the laying on of hands, the auscultating of the heart and the lungs, the palpation of the abdomen can identify masses or maybe an abnormal mole that would need to be biopsied. So the actual interaction with the physician is valuable, separate from the testing and the labs. Also, the value of the incentive program. The employee, and we have this experience with many of our employer clients, is that the employee said that they really would not have gotten that preventative physical unless they had had the financial incentive as part of their plan design. Now, the actual physical itself is typically free, right, with preventive care being covered at 100%. But even beyond removing the financial barrier of not having to pay for it out of pocket, those additional financial incentives are oftentimes needed. And that's where we see historically that companies typically have about 20 to 30% of their employees have actually seen a primary care physician over the previous 12 months. So that leaves, a good 70 to 80% of people that have not seen a primary care not only in the past year, but oftentimes in the past 2, 3, 4, 5 plus years, maybe even a decade or more since they've seen a physician. These are oftentimes kind of thought of as the working well, or they think that they are doing fine when in fact they have some sort of underlying brewing condition. In this case, thyroid cancer. And so this is how health activation. So this was essentially behavior change or action that was different, right? Historically, she had not gone to primary care physician preventative screenings, and then this time she did. And it ended up, first and foremost, early detection, a better outcome for her. The cancer was contained to just the right lobe of her thyroid, and then, of course, it's also just, at the end of the day, lower cost, not only out of pocket for her, but for the plan as well. And so this was a very serious event for a healthcare consumer. So now we're going to move on to the next example. So here, an employee used Compass 74 healthcare solutions since 2012 for herself and her family. Compass has provided the member with cost estimates related to prenatal care and testing, labor and delivery, dental care, optometry care, allergy testing, and an upper GI endoscopy, just to name a few. Compass has also performed 19 bill reviews for this member. Compass has performed multiple doctor recommendations for providers, including an allergist, gastroenterologist, ophthalmologist, dentist, optometrist, and a physical medicine and rehab, otherwise known as PM&R, physician. Of note, this last specialist was used to address low back pain via steroid injection and physical therapy, a less invasive choice as compared to an orthopedic surgeon, showing strong healthcare consumer behavior. So, activation, but different than the first example of activation. So what are the take-home lessons of this example of activation? So one, almost all non-urgent healthcare decisions were made in partnership with Compass. And so this is where this member realized or knew that they needed additional assistance for behavior change. And so that's essentially part of the model of behavior change, is to make it as easy as possible. There are always reasons for being a better healthcare consumer and for increased health activation. Those reasons include, obviously, better health, longevity, less out-of-pocket cost, maybe less time off from work or more time with your family. Those are the reasons for it. But then there are also the opposing reasons against. And this is where employers or individuals need to make sure that they have some type of approach or strategy to make those forces against easier. So forces against being, I don't have time, I don't understand medical terminology, I'm confused by my paperwork, I don't understand medical coding, I feel intimidated by talking to healthcare professionals, like my doctor. So all of these reasons that oppose activation also need to be addressed. Notice, too, that this person was not only doing solutions for herself, but also for her family members as well. So we also oftentimes see that the activation of one person affects other members within that same household. It was a combination of both proactive cost estimates and reactive bill review assistance. So not all activation happens beforehand, not all activation happens afterwards. It's really a combination of the two, depending upon where the member has a particular pain point in their healthcare journey, if you will. And there was really a diversity of healthcare scenarios, from allergies to heartburn to eye care to back pain. So it really was across the spectrum. And so you might consider, so the first healthcare consumer was a serious medical condition situation, and really this was it was a bumps in the road healthcare consumer, kind of having these little blips quite frequently, dozens and dozens of times over several years, that Compass was able to help with each one of those blips. And as a result, they were able to get fantastic care in a cost-effective manner. Next example. I just need a male PCP, or primary care physician. This is another actual Compass member outside of Grand Rapids, Michigan, who's interested in finding a male family practice PCP. So that was this, we find physicians for members all the time, and this was this particular gentleman's request into Compass. Okay, the search begins. The Compass Health Pro and her team searched in-network doctors in the member's area and found 3 who had new patient appointment availability within the next 2 weeks. Red. The 3 doctors had been in practice for 24 to 30 years, so they're very experienced, were all board certified, and not had any actions against them by the Michigan State Medical Board, had positive patient reviews and the highest staff customer service rating, 5 out of 5, when phone screened by Compass. So these 3 physicians would be great options for this gentleman. However, in order to locate these 3 physicians, Compass had to 19 other in-network male family practice physicians in the area who were either not taking any new patients or had very poor patient reviews were researched. So in other words, it wasn't just like, oh, the first 3 doctors that Compass searched ended up being a great fit. It actually took quite a bit of research on our end to find physicians that specifically met not only the profile, but also the patient availability, also the high customer reviews, also the quality reviews as well. This solution shows the detail and time consuming searching that the member did not need to perform to find the type of doctor he wanted, because he was able to leverage Compass for support. The solution also shows good healthcare consumer behavior in wanting to find a PCP for care first, rather than self-referring to an oftentimes more expensive specialist to start. So this gentleman, had he not had tools and support from his employer provided by Compass, and he would have had to have done that searching all on his own. We talk about forces against and not having enough time. He would have had to screen through 19 other physicians to maybe get to one that was a male, that had appointment availability, and he was just trying to do the right thing, right? He was being encouraged by his employer to have a primary care physician, but easier said than done. So in this case, Compass was able to make that much easier, right? So one, even when told of the importance of finding a PCP, doing so is not always easy. 2, people have specific preferences when it comes to their PCP that need to be met. In this case, male. 3, doctors not taking new patients and new patient appointment availability are real barriers to greater primary care utilization. By and large, there is no centralized database or repository of appointment availability. There's no open table for restaurants. There's no open table for physicians. And so literally you can go on your insurance carrier website and you can find in-network physicians, but it's not always up to date as to whether or not they're even taking new patients. And then 2, you most certainly don't know their appointment availability. And for whether you're in a smaller town like Grand Rapids, Michigan, or if you're looking for a specialist like a dermatologist, new patient appointment availability might not be for 6 or 8 weeks. So you call, you find that out from the office, and then, 8 weeks, that's too far out. I got to go back to the website, find another doctor, call again. 4 weeks, that's still too long. Go back to the website, call another physician, and so that process can become very discouraging. A lot of people just give up and end up just not going to see anybody at all. Poor patient experiences can be a barrier to finding PCPs with a good bedside manner. At the end of the day, people want to be treated respectfully, fairly, and kindly by their physician. And there are certainly many, many physicians that fit that description, but there are some that do not. And certainly being able to find a physician that has a bedside manner that fits with your style is very important to having what's called a therapeutic relationship. And this is real. It's important to have a therapeutic relationship between the patient and the physician, and that's only going to work if their personalities gel, especially with a primary care physician. So this is a perfect example of the trying to do the right thing health consumer. I'm trying to do the right thing. I'm motivated to do it. It's just hard, and we need to make it easier for them. Okay, next example, specific specialists needed. A member of Massachusetts contacted Compass for a cost estimate for a Mohs surgical procedure for the removal of skin cancer. Mohs surgery is a complex procedure that involves the removal of the tumor, and then during surgery, having the tumor sent to a pathologist to have the tumor sliced, staged, and examined under a microscope to determine if there is any remaining tumor in the patient. The Mohs surgery involves multiple CPT procedure codes, including 17311, 17312, 14040, and 17132, all of which were confirmed by the Mohs surgeon's office after being contacted by Compass. Total costs for 3 different high-quality Mohs surgeons in the members' area range from $5,800 to $6,400, with the cost variation being due to the difference in the facility fee, not the surgeon's professional fee. The employee chose the most cost-effective of the 3 options. So wow, that was a mouthful, and that was complicated, but there's some real take-home lessons here. So one, employees often don't even know the name of the type of doctor that they need. So the medical terminology of just understanding, Mohs, especially named after the surgeon that first pioneered this surgical approach. But as you can imagine, you can have all types of pronunciations and spellings of that word, and Compass is able to have that type of open-ended conversation to really ascertain what's going on here. Oftentimes, I'll tell you, if you're looking on an insurance carrier website, you're not going to be able to specifically find quote-unquote Mohs surgeon on there. 2, employees seldom know all the CPT codes for the potential procedure and often don't even know what a CPT code is. So in this case, you think, oh, surgery, just one CPT code, right? Well, no, there's actually a whole bunch of CPT codes. And for surgical procedures, that is oftentimes the case, that multiple CPT codes need to be used. And this is where not only can Compass find out specifically what those CPT codes are, but then we can use our own database and pricing information to then find the prices for each one of those CPT codes and then add them together. You know, certainly if you have price information around 2 CPT codes, but the whole procedure actually requires 4, then that pricing information is not going to be accurate. So really diving into the details around coding to give accurate cost estimates is one of the key benefits of using a service like Compass. So the facility fee is often the source of the greatest cost and cost variation, and it's not the physician's fee. So in some cases, the same doctor, the same surgeon will operate at the hospital on one day, the surgery center on Tuesday, and the cost between the hospital and the surgery center will be very different. However, the surgeon's fee is going to be the same. So the doctor's going to get paid the same amount regardless of where you have the procedure done, but the facility fee is very different. Upwards of 3 to 10 to 15 to 25,000. We had one member who went in for a prostate surgery, and this was not between hospital and ambulatory surgery center, but between 2 hospitals that were literally about 2 miles away from each other on essentially the same highway. And there was in this case, this is an outpatient prostate surgery. There was a $50,000 difference between those 2 facilities, same urologist at both facilities. So that facility fee difference is very impactful. And so where one has the surgery is often more related to cost than who does the surgery. So it's not the surgeon's fee changes, it's that the facility fee changes, okay? So this is a very nuanced, detailed healthcare need where activation, frankly, is challenging just from all of the nuances and just all the detail that's required for being a healthcare consumer in this scenario. Next, let's move over to prescriptions. So this is a prescription RX health activation example. So here, a member in Columbus, Ohio, called Compass regarding a review of the medication Denavir. The Compass Health Pro and her team performed a prescription review and notified the member that Denavir is a Tier 3 medication that costs $680 for a 30-day supply. The Compass Health Pro also alerted the member that Denavir has several Tier 1 alternatives, valacyclovir and acyclovir. The member decided to switch to acyclovir, which cost $218 for a 30-day supply. The resulting savings is $462 per month. So that's huge, and this is a chronically taken medication that is often taken months on end. So that $461 could easily add up to $900 or $1,300 or $1,700 just over 3 or 4 months. That's rent. That's car payments. That's groceries. That is meaningful to the vast majority of our members. So what are the take-home lessons here? 1, a person's physician likely does not know the financial implications of their prescription. When that doctor prescribed that Denavir, they were intentionally trying to cause financial hardship to their patient, but they just didn't know. It didn't even, I'll be honest with you, it doesn't even cross their minds. And it really it takes us to point 2, which is that patients really need to look out for themselves when it comes to prescription costs. And sometimes the doctors can kind of, if you ask the physician if it's an expensive medication or if they know how much it costs, sometimes they'll know, but they'll often need to be interrupted and asked a question for this. And then right then and there in the exam room, one can ask the physician, listen, cost is an issue for me. I'd like a less expensive, or I'd like to treat this in obviously a clinically effective way, but is there any way that we can do this cost effective? Money is an issue for me. Is there a medication choice that's affordable? Using an outside expert such as Compass to help find alternatives can make it easier to save on prescriptions. So certainly, some people are capable of having that conversation with their physician, and their physician is able to write them a new prescription on the spot. However, sometimes people need help.
And this is where the member will either like literally call us from the doctor's office, or sometimes they'll call us from the pharmacy, and we can have the physician call in the new prescription, or sometimes for the direct generics, the pharmacist can just switch it right then and there. But just the names of the medications, acyclovir, valacyclovir, sometimes they're just hard to pronounce. Two, people, again, just kind of feel intimidated talking to their physician. Or three, they just don't want to take the time, or they feel like they're stuck. And almost what's really sad is that they get to the pharmacy, and then the pharmacist says, you know, that's $461, and then they just don't fill the medication, period. And so there, you're going to have, you know, worsening of their symptoms or of their condition, where it's like, well, you don't have to go cold turkey and not take any medication. I mean, there oftentimes is an option that is cost-effective and affordable for people, but you have to either do it on your own or use a service like Compass in order to get that prescription change. So I would say that prescription challenges for consumers are definitely front and center when it comes to behavior change or health activation at Compass. So we're going to be coming to a close here on the webinar. So let's summarize the activation take-home messages from these various scenarios. So one, not all healthcare consumers are the same. Therefore, not all health activation is the same. There's the serious event healthcare consumer, like the thyroid cancer. There's the bumps in the road healthcare consumer, like the woman that used Compass 72 times over the course of 3 years. There's the trying to do the right thing consumer, of finding a primary care physician and just having a hard time doing it. There's the nuanced need healthcare consumer whose scenario is just complex and needs expertise to address that complexity. And then finally, there are prescription challenges in terms of activation and behavior change as well. And so that's where we've really found at Compass that our technology platform and our member portal, which is responsive web design, so they can do it on their tablets or their phones. It looks just like a mobile app, is a great way for them to be activated in their health and actually keep track of. You can see here on the smartphone here, we actually can help people keep track of their incentive programs right there on their Compass member portal. We integrate with other incentives, like through their wellness incentive or what have you, so it offers one place to track all of the incentives that oftentimes are used to motivate the initial behavior change. And then two, then we have the Health Pro, who's highly adaptable and highly skilled and highly consultative in supporting our members as healthcare consumers, helping them to find physicians, helping them to compare cost and quality. And you'll see on this slide, to instill a culture of healthcare consumerism, you have to meet employees where they are. So when people first contact us, they actually very rarely say, I've been referred to my doctor, by my doctor for an MRI. Could you please give me a cost estimate at 3 facilities for this MRI? They typically start with one of these 3 common pain points. One, just understanding their benefits. I've got an issue with my foot. Hey, how do my benefits cover the feet and podiatry? I don't know. Well, some services are covered, some are not. 2, finding a great doctor. I'm looking for a primary care doctor. I'm looking for an OB-GYN. I'm looking for a dermatologist or an ophthalmologist, orthopedic surgeon. Just finding doctors at a very basic level is one of the most common services that we help people with. And then sometimes we help people after the fact. Oh, yeah, I went to the emergency room. I got this bill for $750. I just don't know. That doesn't seem right. It's an awful lot of money. Compass, could you review that and see if that's really the case? So I really owe that $750. And then it's oftentimes after we help them with these 3 categories of solutions that we then subsequently help them with an evolving employee mindset. So that's when we then help them be comparative shoppers for medical care and helping them pay less for their prescriptions. We had a curriculum campaign of education that we use in partnership with employers to educate their employees about how to be better healthcare consumers over the course of the year, because it really does take an education and curriculum and that side by side, right? Because you think of it like coaching. Like when you're coaching someone, you might be providing some degree of classroom instruction, but then you're also doing it alongside of them to help them change their behavior, whether it's related to a sport, but in this case, been related to being a healthcare consumer. And we've actually found that 61% of folks that start off with those administrative-like services in the beginning end up coming back for cost and quality impacting services at a future date. And so that's where Compass can really act as the administrative medical home for, okay, I need to see a doctor this week. Help. I need to find a good dentist for my kids. Help. Is this procedure covered? Help, Compass. How much is my surgery going to cost? Why am I getting so many bills? Is this bill correct? And Compass can not only assist with navigating all those questions, but then integrate all of an employee benefits plan's vendors, their medical carrier, their PBM, dental, vision, wellness, biometric screening, to make it one easy access point for the employees. And so that brings us to the conclusion of our health activation webinar for today. As I say at the end of these webinars, and it's totally true, you've given me the most important thing that you have, which is your time and attention, and I sincerely thank you for that. If you'd like to learn more about Compass, please feel free to email me there at ericb@compassphs.com. You can also find my blog on our Compass website. I'm also active on Twitter with almost 2,000 Twitter followers at Dr. Eric B. And then if you'd like to see other webinars that we've done in the past, we actually have them recorded on our website as well under the Best Practices tab. And so with that, I want to wish you happy holidays and hope you have a fantastic rest of your afternoon. Bye now.